A group of vaccine experts is meeting this week to talk about a new proposal from the FDA to make COVID vaccinations a once-a-year shot, like the flu shot.
This as we just marked the 3rd anniversary of the first COVID case in the U.S. on January 20th.
UW Health Chief Quality Officer Dr. Jeff Pothof is back with us for his weekly visit. Hi, Dr. Pothof. Good to see you.
Good to see you guys, too.
So this meeting at that the FDA is holding, the experts are going to present data that shows most of us have enough protection now from COVID that we could move to one shot a year. What do you think about that?
Right. I think this would be great because right now it's even hard to keep track of, am I due for a shot? If I'm due for a shot, which one? And do I have to mix this up or do that? So if we got to the point where COVID-19 was a group of folks looking, say, in the spring about most common variant, they developed that vaccine, and then there's just one COVID-19 vaccine that we get in the fall, that would be pretty easy, and you said it right. So we've had enough exposure to COVID-19. There's enough folks vaccinated where we're not seeing nearly the same number of people get severely ill when they get COVID-19 as we did earlier in the pandemic. We might be able to go a year between COVID shots, which I think everyone would be happy about.
So COVID and flu shots in the fall?
Yeah, maybe same day, left arm, right arm.
Or one shot.
Oh, maybe. That's not yet in like the final testing phases, but we do have manufacturers looking to try to combine some of these vaccines, so it is just one shot.
The needle's as big, but...
Yeah, and all the different variants, though. I mean, would it be trickier with COVID than it has been for flu?
So it could be. So flu changes every year, and what we'd want to see is, you know, right now, ever since Omicron, every variant after Omicron has been an Omicron subvariant, and the vaccines have done a pretty good job, not necessarily against symptoms, but against severe disease. So as long as we continue to see Omicron-based variants, we can tweak that to match whatever's out there, and it likely would provide good protection. You know, the fly in our jam would be if a brand new variant, completely different from Omicron, came out, that might necessitate some sort of deviation in that annual schedule just to cover that. But we haven't seen anything other than Omicron for quite some time now.
And there's no way to predict that.
No way to predict it. I mean, statistically, the more the infection is passing around to people, the more likely you get a variant. But as the infections calm down, we don't give the virus as much chance to mutate. We don't see as many variants.
We don't really know what the current situation is because so many people are home testing and other people are getting sick and not testing. But the best barometer is always what's happening, what you're seeing at the hospital. And what is the current situation with COVID and with the flu?
Yeah, so basically good news. So COVID numbers are pretty stable, nothing that's too overwhelming. Flu numbers have continued to remain lower. We were worried that might bounce back up. It really hasn't. And even RSV, higher than it would typically be during an RSV season, but at least within the realm of normal versus a couple months ago, it was just absolutely crazy how many RSV cases we were seeing. So for the most part, respiratory disease not the reason that hospitals are busy right now.
And this new variant really is breaking through all barriers.
It's pretty contagious, so even folks who are vaccinated, they're likely to come down with some symptoms, a good proportion of them. But it is, the vaccines are still protecting against severe disease. So I think we have to get in the mindset that, you know, getting vaccinated may not keep me from getting symptoms, but it'll keep me out of the hospital, it'll keep me from having a worse course of disease than if I had chosen not to be vaccinated.
If you get exposed to someone who has COVID now, since it's going around a lot, should you test if you're exposed, or should you wait until when and if you show symptoms?
I think if you're in a normal risk category, you're hanging out with people who are in a normal risk pool, I would probably wait for the symptom first and you know, be kind of on edge for symptoms. It might be a headache, it might be something subtle. I think I would test asymptomatically if, say, I lived with someone who was really high risk and I wanted to make sure that I wasn't be positive and pass it to them. Then you might say, you know, I'm going to wait until day 3 and then I might do a test for the next couple days just to make sure that I'm not exposing that high risk person to the disease.
And you might not necessarily test positive at first.
Especially with antigen tests, it can sometimes take a bit. So, you know, what I tell people is if you have some symptoms and you take an antigen test and it's negative, that doesn't mean you get to go to the party. That means you got to hang out for a couple more days to see if you pop positive, because even if you don't have COVID, nobody at the party wants whatever else you're going to give them.
It's 3 days from exposure.
Would be about
Ballpark.
The earliest. 3 to 5 is when you should be positive. With an antigen test, you might not pop positive till day 5, 6, 7, somewhere in there.
If you're sick, stay home. We said it last week.
Yeah.
Even if it's not COVID.
Even if it's not COVID.
Jeff, good to see you.
Good to see you.
Same.
See you next week.
See you guys.